Hello, my name is Gisela Chapa, and today I'm going to be talking about the economic impact during COVID-19. The economic crisis we're experiencing has truly unusual characteristics. It is the first crisis by design in history. This crisis is triggered not by any problem in a particular market, such as debt, subprime bonds, financial sector, etc., but because governments and society decided to shut down the economy as a measure to combat COVID-19 spread. The social economy played an important role in addressing and mitigating the very short and long-term impacts of the COVID-19 crisis on the economy and the society. Speaking in short term, the social economy actors have been an important part of the recovery from the crisis, suggesting innovative solutions whose main objective is to strengthen public services to complement government actions. In the long term, social economy organizations seek to reorganize the post-crisis economy by creating and promoting economic models that are inclusive and sustainable. Based on years of experience, the specific characteristics and underlying principles, models with a high degree of social innovation can emerge in the social economy and at the same time create a sense of purpose for most companies operating in the economic today market. Here we have a graph of the US economic growth since 1915, where we can clearly see that from 1915 through 1980, we have a positive percentage of the economic growth, but then on the 2020, we can clearly see a really negative percentage of the economic growth since the COVID happened. The purpose of this research was to explain how the COVID-19 pandemic has affected the global market, how much percentage the economy has declined, speaking in terms of import and exports, and to observe which economic sectors have been the most affected. Also to find out if the COVID-19 contagion index presents any relationship with the age of the patients. On the other hand, I also hope to be able to investigate how the government and society are planning to reactivate the economy to the point where it was before the pandemic or even better. COVID-19 has not been a virus of equal opportunities. It affects people with poor health and those who, due to their daily lives, find themselves in need of living with a high number of people. This means that it disproportionately persecutes both poor countries and advanced economies like the US, where access to health care is not fully guaranteed by the government. Across the world, there are marked differences in the way the pandemic has been managed, both in maintaining the health of its citizens and the economy and in the magnitude of previously mentioned inequalities. We also have a graph of the number of daily cases and deaths in the US. We can clearly see that we have less number of cases in the United States than the number of deaths, since we mentioned that the healthcare system was not guaranteed to every person in the country. During this investigation, the method of gathering information was to investigate various articles, reliable internet sources, electronic newspapers, magazines, organizations that are based on the topic of finance and the world economy. Some of them were Forbes, BBC News, CNN, OECD. This because the topic is based on the international economic situation. The author couldn't obtain information from the sources around them, nor could they conduct interviews or surveys. For this reason, they relied on information previously published by specialists on the subject, graphs, statistics, running data, and other data from various sources of media. Some of the questions on this research were, does COVID-19 differentiate gender, age, and social class? How was the economy affected by COVID-19? And how to reactivate the post-pandemic economy. Then we also have a graph when we can clearly see that the people from 0 to 50 years were the less affected because of their health. But then the ones starting from 59 through 80s and up were the most affected and a big part of the death cases. The results demonstrate the correlation that exists between the registered cases of COVID-19 according to the age of patients and respond to the question of how it affects the world economy. Causes noticeable differences in the percentage of mall imports and exports in the period of a defined time. It was a total of 25 visual figures that we used to demonstrate the data and the graphs. Our visual figures show that the data that refer to the great difference between the number of cases of young COVID-19 patients and older patients. The risk of serious illness due to COVID-19 is much higher for older people than those with underlying medical conditions. Those over 60 years of age accounted for more than the 80% of the deaths. Certain diseases can make people immunocompromised, which means that their immune system are less able to fight this virus. Much of this can be attributed to the age-related immunodeficiency and inflammation, but some diseases bring more complications in the COVID cases. The world population faced a new situation. It was not contemplated in any sector of the world. This generated health, political, economic, and social crises. The national government should join forces to strengthen the health system and ensure the coverage of care with quality, efficiency, and effectiveness to face the current pandemic of COVID-19. At the moment, the possibility of the vaccine is already available. The population has to accept this contingency and learn how to live with it. The economic reactivation must be carried out considering that the current situation of the country on economic, social, cultural, and environmental issues use current resources and organize strategies to mitigate the risk of contagion. Some of the sectors affected by COVID-19 must reinvent their business idea according to the current contingency, using its entire structure to generate new opportunities, boosting the country's economy. My references are listed below, and I also want to thank to Mr. Gabriel Carranza and the persons listed below for helping me to conduct this research. Thank you.